I'm the Director of Cardiopulmonary Services here at Southeast Georgia Health System. My areas of responsibility are cardiac rehab, cardiology, cath lab, respiratory, and sleep lab. So during the pandemic, we had various opportunities to address a lot of the issues that happened in the community. One of those issues was just the total influx of COVID patients during the second round of the pandemic. The staff really mobilized cardiac rehab. They became door monitors because our program was closed. Cardiology, we still saw several of our outpatients, and if the nurses weren't working, they were on the floor in other areas of the hospital. The nurses in cardiac rehab, they helped swab patients for COVID out in the community and for the Department of Health. So in cardiac rehab, because the department was closed, nobody was here, so they found other opportunities within the hospital. In cath lab, we still had procedures in the cath lab, and if they weren't busy, they were mobilized to other areas of the hospital as well. Sleep lab, we still saw sleep patients during COVID. I think we were closed maybe for 2 months, but after that, we continued to see our sleep patients. In respiratory, I think the pandemic had the biggest effect on the respiratory staff because it was such a high demand for respiratory. We had some staff members leave, we had some staff members transfer, but most of all, we had a wonderful core group of therapists who decided that they would just stay and help this community. During the height of the pandemic, we had 62 to 65 ventilators running per day. And it took a really toll on the respiratory therapists because the amount of people we took care of that passed away. Out of all that, they stayed, they cried a lot of tears. We were joyful when we had patients that we were able to liberate from the vet and they were able to go home. But I think the staff members in respiratory and the rest of the hospital who decided that through the pandemic they would travel, that they would stay here and help their community is the best part of the community because they are vested in this community, they stay to support this community, and in the end it was I think a positive experience, not COVID itself, but the camaraderie we had with each other. All I can say is thank you from the bottom of my heart, and if you know me, you know what I'm telling you is true. I love you dearly. I love everyone in this institution. And thank you for being kind, loving, caring staff members at Southeast Georgia Health Systems. Thank you for being my staff members. Thank you so much, everyone. I appreciate you and I love you.